As time goes by and more research comes out to confirm what I've been saying for years, there is only a transient sense of, I told you so, but it's then immediately replaced by a big concern. Because if this is right, are the other predictions correct as well? And many of the other predictions are far more serious than what I'm talking about here. And what we're looking at is a study looking at the association between SARS-CoV-2 vaccination status and the risk of influenza-like illness and loss of work days in healthcare workers. This paper was just recently published, and it's essentially confirming what we've all thought about for quite a long time. But as I said, there's a far more serious question. If these points that have been mentioned and considered misinformation for years are being confirmed, what does it mean for the future? Because the biggest concern that I've had is this principle of the COVID storm, where you have recurring infections in a vaccine primed population leading to significant autoimmune responses. That, for me, is the most serious concern. And as I said, as soon as you've gotten past that mild ego tweaking that can come with thinking that, yep, you've got this about correct, you then have to replace it with a very sober and factual concern about what is likely to come based on the fact that the virus is still circulating. You may not be aware, but wastewater levels are rising in the UK and the US. We're going into probably another wave over the summer into the autumn period. Disease presentation is likely to increase. We have no idea what's going to happen next. But let's concentrate on what this paper was showing, and I'll just make a few very simple points. As I said, this paper is looking at the association with influenza-like illnesses in healthcare workers. Healthcare workers are important because they were at the front line. And one of the questions that I'd always had was if healthcare workers had previously been exposed, they already had natural immunity. What is it that you're hoping to achieve by then vaccinating people who already had immunity? That was the first point that I had. But straight away, I've highlighted here in this paper the conclusion, which we'll come to or which we'll go through in a little detail. Based on our data, we conclude that the SARS-CoV-2 booster vaccination does not contribute to the protection of the healthcare workforce in a post-pandemic setting. Now, it's important to note that these papers almost can't get through the net if they don't say something like this. The SARS-CoV-2 vaccine has contributed majorly towards ending the pandemic worldwide, and booster doses have been recommended for populations at risk. That's the starting line for this paper. Yet at the same time, it doesn't seem that they are correlating their findings to what it is that they are seeing. And as I said, this is a problem with a narrative in terms of even when what you see is right in front of you, it's overlooked because of the narrative. Here is the important point with this study, though, and we appreciate the fact that they did this because I'm calling out any paper that doesn't do this as part of their process. And what they did is that the baseline characteristics of healthcare workers in October of 2023, they have an unvaccinated cohort here. 175 of the over 2,000 were included. Then they have 1 to 2 doses, 3 doses, 4 doses, and then they break it down in terms of comorbidities. The people with the highest comorbidities have been getting more doses, which makes sense. They would have been perceived as the highest risk. When you go down, there's one point in this table that I wanted to highlight, and it is to do with anti-S titer, This is about the levels of spike protein antibodies in the bloodstream. In the unvaccinated, you can see here the trend or the number is 93 to 1811. They were at about 537. In every single one of the vaccinated cohorts, it's off the scale over 5,000. And you can see that, well, it says here between 3,800 to 5,000 for those who had 1 to 2 doses, over 5,000 for those who had three, over 5,000 for those who had four. We don't know what over 5,000 is. It could be 6,000, it could be 20,000, it could be 30,000. And we've seen exceptionally high antibody levels. But this just highlights to you that numbers, because this is what they had used very often to demonstrate efficacy, is they said, look, there's a strong antibody response. What it means is therefore that they are likely to have greater protection. What the evidence has been showing is that if you don't have the right antibody, because the majority of antibodies being produced in those who are vaccinated, or especially early in the pandemic, are to the original variant of the virus. And for the new variants, it's unclear what percentage of those antibodies are actually neutralizing to the virus. Additionally, a significant proportion are likely to be IgG tolerant antibodies. And so, with that information, it would then fit with what it is that we are now seeing. So, I'm going to put together the slide here just to show you what it is that they found. Because what they then did is they followed them over about a year, looking at symptoms related to potential exposure, what they called influenza like illness and loss of work days. And so this is effectively what they found, and they removed as many confounders as they could that would contribute to these numbers. But here is the facts. Looking, this is figure two, participants who experienced influenza like illness episodes during follow up. So there was a total of 1,700 participants in this Swiss study. And what they have here in this chart that we're concentrated on is that they are looking here the number of episodes of influenza like illness. 0 is this light pinkish color. 1 is yellow, and greater than 2 is greenish brown, greenish blue. Then you look at the number of vaccinations here. None, 1 to 2, 3, and 4. And what you can clearly see is that in terms of the percentage of participants, the highest percentage in the unvaccinated cohort. And you can see the percentages are lower, about the same, slightly higher for the 4 vaccinations, which is interesting. About the same, you would say. When it comes to having one episode, you can see here for the unvaccinated, it is at the lowest bar in terms of percentage across all of these groups. And greater than 2 episodes, this is highest in those who have had 4 vaccinations, booster doses. And so, what is clearly indicating is that the higher the rate of vaccination, the greater the percentage risk across the population for greater than 2 episodes of influenza like illness patterns. And you have to presume that this may be COVID. It's not necessarily COVID, but certainly viral illnesses that have contributed to loss of work days. And that's the essence of what they are seeing here in this study. And this is why, when it came to the prediction, as I said, in terms of the conclusion, they highlighted this point with regards to the fact that I'm going to highlight it here for you. Based on our data, we conclude that SARS-CoV-2 booster vaccination did not contribute to the measurable protection of healthcare workforce studied, and may even temporarily increase the likelihood of symptomatic infection and workday loss. So this is the reality that we have been seeing, because the healthcare workers, you have to remember, in effect, would have the highest level of mucosal protection because they had been very exposed early in the pandemic. And this is why I said that a lot of people don't understand. The better the mucosal immunity, the less likely that the virus can penetrate and get into the systemic system and trigger all kinds of autoimmune and other responses. And so for the healthcare workers, they already had very good levels because of previous exposure. One of the areas that I wanted to find studies on, and I really struggled, I don't know if anyone could find it, is when you compared the healthcare workers who died in the first wave of the pandemic for frontline and then the second wave. And the my expectation would be a significant drop off, not that none died in the second wave, but because of mucosal immunity, their immune system was not predisposed to having severe COVID-19. And so the question still needs to be answered. If they already had natural immunity, were they put at greater risk by being vaccinated unless they had a known immunocompromised situation or something else that would predispose them to more serious COVID infections? What is very clear from the research here, and it's pretty clear when you look just observing in highly vaccinated regions, that cases are rising. It suggests that population immunity has been damaged. And this, therefore, research is confirming that point that we're saying, that population immunity does seem as though it is not as effective, even in healthcare workers. And just as a final point here, this is what it means. Unvaccinated here, the highest percentage of no influenza like illness. Unvaccinated, the lowest percentage of greater than 2 episodes of influenza like illnesses. And so this is significant because you have to remember every exposure to the virus can trigger longer term complications, even in the healthcare workers. And so the biggest risk now going forward is, are we likely to cause a significant long-term illness, mortality, morbidity, and mortality to one of the most important groups in a situation where the population is already under the pressure of ongoing circulation of the virus? These are big questions, but as I said, there is no pleasure now with the fact that this is being confirmed. This was always obvious. It just took a while for people to see it in a peer reviewed paper. What we now have to worry about are the population health implications as we continue to move forward with the pandemic as it is. Let's keep our fingers crossed, because at the moment, the only thing you can do, it seems, is to hope for the best. Have a good evening.